And those are all the terms that we're going to use throughout this course. And then we're going to start into a little bit more depth of the central nervous system, peripheral nervous system, and then end by touching on some really fun facts about what you can do with having some of these special senses. So first, for effective communication. Needed for effective communication, you left me for Brownie. Who is Brownie? Says, no, I said I left you 4 brownies. This is an example of an actual case I was involved with many years ago. This is, I'd say, more than 20 years before we started doing, timeouts, when people would make sure before any kind of cut was made that they were sure they were working on the correct side. This is a patient, an elderly woman who came in with a hip fracture. It was late in the evening. The surgeon was lying down in the lounge. The patient was prepared, positioned on the bed. Drapes were put down. So when the surgeon walked in, all he saw was a small area that was prepped out with the sheets. And so he started in cutting through this hip, got down to the hip and realized that there was nothing wrong with that hip. Looked up and realized that they had positioned the patient in the wrong position. Now, everyone in the room is responsible for these wrong site lawsuits. Doesn't matter if you're an assistant, anesthesiologist, everybody gets listed in a wrong site lawsuit. So these are some of the terms. Knowing right from left. Right is the person's right, not your right side as you're looking at them. The right side, if you're looking here, distal is distant from the center of the body. Proximal is closer to. Pro is getting closer to the best, like the pro. Pros are the experts. Medial is middle, more toward the midline. Superior, I think of the brain as superior to all other organs. So superior, and then inferior going down, opposite of superior. And lateral, I think of the lats or lateral pull downs. Lateral is away from the midline. So the body cavities, keeping the organs organized. A case presentation is a newborn, just born, having difficulty breathing. Notice that the baby's getting bluish. The abdomen is sunken, which is not usual for a newborn. Usually have a nice big bellies. Scaphoid is the medical term for sunken belly, sunken abdomen, scaphoid. Respiratory distress, so they're breathing rapidly, and they're hypoxic, meaning the low oxygen. The term for no oxygen would be anoxia. What this child has is a diaphragmatic hernia, where there's a hole in the diaphragm. It's gone up into the chest and it's compressing the entire left side of the lungs. The reason the scaphoid abdomen is the intestines have all moved up into the left chest cavity, compressing the lungs, which also can compress the heart. Okay, so what is the cut or the plane of this image? Frontal, sagittal. Your other option is axial. Answer is sagittal. This type of cut makes cuts the person completely into 2 equal halves. I think of saggy pants, where the crotch of the pants are hanging down low, and that is dividing the body exactly in half. saggy pants. So sagittal plane looks like this. And if you're looking at the sagittal plane, you'll see the diaphragm separates the contents of the abdominal cavity from the thoracic cavity. And the other cavities here shown cranial cavity and vertebral cavity. And then of course, below the abdomen is the pelvic cavity. Next question, what is the cut or the plane shown here? And the answer, you can have either one of two answers, the frontal or the coronal. Both answers are correct. Both describe looking at a person from the front. So a coronal plane is where it's actually, this is the way I think of it. Coronal, or is another term for crown in Latin probably. And so I think of a one-dimensional crown gets put on a person's head and slices down through the head and the entire body, exposing the front. This is a coronal plane. I think of frontal. You could think of frontal as like full frontal nudity, or looking at someone's front side. So as we're looking at this plane, these cavities, you'll see that in the chest cavity, it's divided into the mediastinum, superior mediastinum, and pleural cavity. I think of pleura as plural, or two, you have two lungs, so plural. And in mediastinum, media means middle, so it's in the middle of the chest and it's underneath the sternum, the bone, the breastbone, middle of the breast, underneath the breastbone. And then superior, nearer to the brain, superior mediastinum. The quadrants, quad means four. This is breaking up the abdomen into four separate quadrants, crossing over the umbilicus. And this is how people start to diagnose what diseases are causing a person's symptoms. So next question, your 12-year-old nephew wakes with a fever, right lower quadrant pain. What could be bothering him? So if you look at these hints, what's inside the abdomen? Stomach's over here. And remember, the stomach is over here on his left side. So imagine yourself as your nephew. Over to the right side, above is the liver, the gallbladder. Down here's the appendix. At the beginning of the ascending colon, or right near the cecum. This is the sigmoid colon. And so your answer would be, that is a possibility, appendicitis. Okay, so now we know the terms, the quadrants, the planes. Let's dive right into the divisions of the nervous system. And then we'll go through some of those cranial nerves. So central, CNS, C, central nervous system, and P, peripheral nervous system. It's the two major divisions. Next question, peripheral nervous system and central nervous system. Do the cranial nerves belong to the peripheral or central nervous system? If you remember, the cranial nerves are cranial nerves 1 through 12, bringing information to the brain. Special sensories are cranial nerves. Are they peripheral or central, part of the central nervous system? And your answer is the cranial nerves are part of the peripheral nervous system. There are 12 pair. They're numbered from the top to the bottom. So this person we're looking at as they're lying supine. So you're looking upwards from their feet, looking at the base of their brain. 4 of the 5 special senses are from cranial nerves. The other special sense is touch, and that's throughout the entire body. It's not just some of the peripheral nerves in the body, but also some of the special senses of some of the other cranial nerves as well. Taste is both from 7 and 9. So the way I think of this, again, the central nervous system is in the center of this round house that I've created here. Things can get into the central nervous system, but it is generally in the dark. It's not naturally exposed to light. Versus the peripheral nervous system, of which the cranial nerves are part, they do have access to the light. So here could be your cranial nerves. So these are the cranial nerves, again, labeled. The ones I find most interesting as far as part of what we're going to talk about in these courses are the olfactory nerve, course number 1, optic nerve number 2, and again, they're labeled or numbered from the top to the bottom. So they just started from the top. The most superior of these nerves was olfactory, then down to optic, and then on down the line to the 11th and 12th. Okay, looking at a sagittal view of the brain, you're going to see how when you cut the brain in half, it's actually 2 big hemispheres. And as you cut it in half, you cut apart this corpus callosum that attaches the 2 hemispheres together. It's white matter, means it's passing information extremely rapidly. It's myelinated fibers. So you're coordinating your left side of the brain and your right side of the brain through this corpus callosum. This includes some of the other structures that I find particularly interesting, that are very clinically significant. Of course, we talked about the thalamus, and below the thalamus is this spot right here. So this is the anterior part. The anterior part's looking toward the chart, and that is the hypothalamus. Hypo is below, hypothalamus. And then, of course, here's the brain stem, the reptilian brain containing the pons, the medulla oblongata, parts of the brain that are responsible for heart beating, breathing, and of course, a little pineal gland. And then, if you want to know what some of these structures do, what they hold, for instance, the lateral ventricles right here, it's just a space here, but it's holding the cerebral spinal fluid. So this is going to be in a PDF on your, as a link on the description of this presentation, and a description of all these structures that I think are the very most important structures to know for the brain. Okay, question again. The special senses connect to one single structure in the central nervous system. Name this structure. Here's your hint. It's one of these that were listed. The answer is it's going into the thalamus. The thalamus is your switchboard operator. Everything comes into it, and the thalamus distributes this information to the hypothalamus, which responds producing hormones. Also takes some of this information, sends it down to the hippocampus for memory, for learning. So it takes all those signals and then redirects it. The hippocampus, one of my favorite structures, looks like a seahorse. Hippo means horse, campus is sea monster. It's the one associated with memory. It gets bigger with learning. It also helps if you learn something and you have emotions attached to it, that they will improve the retrieval of that memory, for better or worse, as you'll see in a minute. So let's go for an example. Freshly baked cookies. The thalamus gets input right away from number one, olfactory nerve. And number two, the optic nerves see the cookies. And then finally, you get to taste them with your tongue, cranial nerve 7 and 9, responsible for taste. And then the hippocampus stores that memory. So the next time you see cookies, and maybe even the next time you think about cookies or see them from a distance, your thalamus gets that input, the hippocampus is activated, that memory is retrieved, and your mouth is going to actually start watering because efferents, those impulses going out of the brain or away from the brain, are activated, and that stimulates your salivary glands in preparation for eating those wonderful cookies. So basically, hearing involves all of these senses, all of your special senses. Cranial nerve 1, smell, 2, see, touch, and taste. All of those are influenced with eating. So without the thalamus, your brain cannot diagnose the sensory information transmitted to it. Nobody talks about the thalamus, but they should. This is a great little visual. It can be found either you could from the PDF, or you can actually Google this image, the cranial nerves and how to remember it under images. But the cranial nerves involved in learning and memory are olfactory, optic, acoustic, glossopharyngeal, all of those nerves, cranial nerves involved in memory. And if you look, if you want to remember the location, and not really the location, if you want to remember what the cranial nerves do, you have to really study this dude from his eyebrows that look like a 3, the trochlear nerve 4, of course, the optic nerves 2, the acoustic nerve, and then, of course, the accessory cranial nerve 10, vagus nerve. That's the wandering nerves. He's kind of back there in the dark because he's going wandering all throughout the rest of your body. So, another question. This is a review question. Which cranial nerves has the most direct pathway to the brain? And here's your hints. Notice the olfactory bulb coming through the cribriform plate, picking up sense of smell. Cranial nerve 1, smell, memories, emotions, and behavior. I'm going to tell you a story, and it's going to be based on the operating room. In the operating room, they use cautery, and it's a way to burn the tissues. After making the incision, they will actually burn tissues, burning some of these blood vessels. It's a very fast way of getting through the operation without having to do a ton of tying knots or suturing little tiny bleeding blood vessels. So this will actually burn the vessels and cauterize. But in the meantime, it also creates smoke, because smoke, fire, and this burning. And it is the burning of flesh. That's what it is, this burning. So it does have a pretty pungent odor. So in this operating room was a medical student who had several tours of duty in Vietnam. And he had done extremely well, got into medical school when he was done, and he was in the operating room for the first time as a third or fourth year medical student, and he smelled the cautery. That was the first time he'd been in there, and he had a complete mental breakdown and had to be taken out and used and gone into treatment program for a while before he could come back to medical school. What he was experiencing was PTSD. Remember, the nose has the most direct pathway to the brain. He was remembering war and the smell of burning bodies. Very emotional. How the um, the nose takes all this information directly into the brain. The hippocampus remembers it, and the amygdala is the emotional part of your brain, right next to the hippocampus. And then it takes all that information and delivers it to the prefrontal cortex, which is responsible for how you react to those emotions and those memories. So this is an example of how PTSD can work with the smell, but it can also work the same way with hearing. Like if you hear a loud sound or a car backfire, your response is going to be go to the ground in case you think someone's shooting you, even though you're not in that context. So sight, sounds, any of your special senses that get stimulated from former emotional memories. All right, let's go on to the cranial nerve 2. This is one also the best one for learning, also for learning. And we're going to go to the magical powers of cranial nerve 2. This is called blind sight. This image is showing how your eyes can be, like when we say I have eyes in the back of my head, it's when your eyes are seeing more than you realize. This is a case example of a 58-year-old man who has a stroke that affected his occipital lobe, where your part of your brain used for interpreting images. So he had cortical blindness. He didn't have anything wrong with his eyes, even though you see this thing across his face to not identify him. So he's got cortical blindness. He put down his cane, and they littered the hallway with obstacles, and then they had him walk down without having a cane. And he was able to maneuver around all the obstacles, missed bumping into anything without the use of his cane. What this explains, or what this is as an example of, is blind sight. If you look at the brain, it does some really interesting things. As the images come into the retina, into the optic nerve, before they get to the visual cortex, they split. They split into two separate nuclei, I guess you'd call it. So they into the LG, the lateral geniculate nucleus, and the LG takes that information, takes it back to the visual cortex, the occipital lobe, and that is where you interpret the images of what you just seen. The alternative route, which as it splits, is it can go to the superior colliculus, and that is telling you where the images are located. So this man still has his eye, still has all these pathways. He just doesn't have a visual cortex. So he has the capacity to tell where things are located in his world, but he can't identify what they are. He can just tell you where they are. So I have LG, like the LG television set. That's taking it to the visual cortex. And the LG is what is seen, and the SG, or the superior colliculus, tells you where you find it. Now, reptiles, frogs, they're using their superior colliculus to eat. So this is used for navigation, for feeding. This is how they can so quickly respond. So humans have both, obviously. So a good example is a tennis player. Now these balls are coming so fast that you can't identify, you can't track that ball entirely using your visual cortex, but you can respond, and what you're using is your superior colliculus to locate the image and act fast. And the LG is responding to who your opponent is. Let's go on to hearing. I think you need a hearing test. Why the heck do I need a hairy chest? This sounds like my husband and I. Okay, so cranial nerve 8, the vestibulocochlear nerve, hearing and balance. Hearing is one of the body's 5 senses, but listening is an art. Let's look at the separate segments of the ear, because this will really help you in the future for pathologies. It's divided into 3 segments: the external ear or the outer ear. The middle ear is the one containing the tympanic membrane or the eardrum, and it contains all the smallest little bones in your body: the malleus, incus, and stapes. Stapes is the horse's stirrup or the saddle stirrup. And of course, the very inner part of your ear contains the nerves, the nerve that supplies hearing and balance. So these are the vestibules for the balance, and this is for the hearing. And what connects all of that, the middle ear, is this tube or eustachian tube that opens up to the back of your nose. This is the one you open when you're trying to equilibrate barometric pressures. Remember how your ear starts to hurt when you're going from one elevation to another? That's because this needs to be open. The eustachian tube needs to be open so that you can equilibrate the pressures. So why this is important? Each of these segments of the ear can come with pathologies. So, and treatments are different too. So the external ear, like swimmer's ear, the treatment would be just topical antibiotics. If it were extreme, perhaps you might add, oral or IV antibiotics, but usually this is treated topically. Otitis media, that's the one that's most common. That's an infected middle ear. The treatment is usually opening this eustachian tube to allow drainage. If this is not open, this becomes an abscess, and an abscess cavity is an undrained infected space. So you treat it with like decongestants, not so much antihistamines that I wrote here by mistake, but mainly decongestants to shrink up these mucous membranes and open it up. And then if this is chronic, you would put ear tubes. And then of course the other is Meniere's disease, and that's where people can have like nausea, dizziness. That's more rare, not uncommon, but it's less common. And that's symptomatic treatment, and also there's some physical therapy for that. So specifically for the middle ear infections, so these are the children that have to have ear tubes, they'll put in this temporary tube under general anesthesia. And like, again, notice how the eustachian tube is getting blocked, probably from a virus, cold. And this, as this fluid sits in here, there's bacteria that's come up from your mouth and the back of your nose, and that can get infected. And that area has to be drained. Okay, a couple things on this slide. What view is this? Is it the frontal, the sagittal, or axial? This is an actual image of a specimen in my lab. And notice how this right here is the eustachian tube, this opening to the eustachian tube, and it opens up into the middle ear. And the answer is sagittal. Now, with flying or diving, that is when you need to equilibrate your middle ear. So holding your nose, kind of bearing down, chewing gum. And what can happen is this tympanic membrane can rupture. And if that happens, cells from your external ear can get in, start moving in, and actually start growing and creating these things called cholesteatomas. So you do not want to have a permanently ruptured tympanic membrane. Now, as far as children with ear tubes, they're in for such a short period of time and they generally fall out within a few days. So it's usually not a problem with children. So why do children have so many ear infections compared to adults? There's differences in just actually anatomy. With an adult, look at how the eustachian tube for an adult is more vertical, so it drains. Things are easier to be drained in an adult versus a child. See how a child's more horizontal. The other thing is that in the back of the child's nose are the adenoids, and they can swell the drop of a hat, and then swelling of the adenoids can actually block the eustachian tube as well. Okay, so we've covered terminology, the directional terms, laterality, body cavities. We're going to use those again and again. And then we've covered the central nervous system, the divisions. We've gone through just a couple of the highlights of special senses, including blind sight, hearing, and ears. So the more you know about your brain, the better you will know how to use its power. Please take a look at the link for your PDF so that if you want to download the PDF, and please subscribe to this channel. Thank you.